Welcome back, listeners, to Learning from Friends. My name is Cade Curtis, your tour guide in this lovely adventure that we like to do bi-weekly together. We are coming up on episode 98 today. We're getting close to that 100 episodes, and I'm excited for that, and it's been a long journey, and I hope all these episodes that we've done over the years together find joy for you as well, and maybe you have a favorite one. If you have a favorite episode, send me your favorite and let me know what it is. And if you're interested on some different topics, send me some topics that you may be interested in hearing about, and maybe I can locate one of my friends to kind of talk about it. But with that, today, we are looking at talking to Harendra, which is a family care physician. They are based out of Atlanta, and they are a good friend of mine, and we are looking forward to hearing what they're going to share about the topic of health care inequality. But before we can dive into that topic here, we got to have my mom's quote of the day. It's tradition. So, Mom, take it away.
You meet saints everywhere. They can be anywhere. They are people behaving decently in an indecent society. Kurt Vonnegut.
Thanks again, Mom, for 98 different quotes that you've given us here over the past 4 years now almost. We're getting pretty deep into this thing. And with that, let's get this conversation rolling. I'm very interested in where this is going to lead because this is a huge topic that has been going on for generations of discussion and is always constantly in the news. But I always wanted to hear from a primary care physician what it's like from their side of the story. So, Harendra, welcome to the podcast.
Thank you, Cade. It's a pleasure to be here.
Now, a lot of people don't know who you are. There's maybe a couple that you're going to forward this to and to get information that knows who you are. Give us a little bit of like a Wikipedia page of yourself.
So if I had to talk about a Wikipedia page for myself, I guess I would start from the beginning. So my full name is Hernadra Fernando, and Nirmal is spelled exactly like Nermal, who is Garfield's arch nemesis in the cartoons, for those of you who are old enough to know that. But I was born in Leeds, England. My family's from Sri Lanka, Colombo, and another small village where my dad's from. I was raised in Kansas, rural Kansas, no less.
You're jumping from all over the place.
Absolutely, yes. I'm a semi-well-traveled person. Not exciting places, but places. But I grew up in a small town called Larned, Kansas. It's population 5,000 and change when I first moved there, and now it's about 4,200, I think, something to that.
So it's dropped.
Yeah. Unfortunately, there's been, I think, a lot of economic stuff going on as a primarily farm community. But having said that, I found my way to Antigua, American University of Antigua, for medical school. Before that, I was at University of Kansas, go Jayhawks. And then I did my residency in New York State, the Institute for Family Health.
So you jumped again from Kansas to New York.
Absolutely. Yeah, that was a big shift. And having lived in actual New York City, Brooklyn, Queens, Staten Island, I think I lived everywhere except for Manhattan. It was definitely a huge jump.
Yeah, from rural to everybody on top of each other.
Sensory overload. I couldn't see the sky, and I almost had a panic attack when I first stepped out of the train station. But that opportunity led me to working for, during residency, the Institute for Family Health, which is the largest FQHC, which stands for Federally Qualified Health Center in New York State. So we treated hundreds of thousands of people across a pretty large catchment area. So a lot of rural communities in New York State and a lot of health disparities. Folks that when you qualify for Medicaid, that means you're typically low enough income where you wouldn't be able to afford insurance on your own.
Okay.
So it's a government-sponsored program. Medicare is something that most people are pretty aware of. When you turn 65 or 64 and a half, you qualify for Medicare. And that's generally for seniors or folks that are on disability. So we saw a lot of what are called dual eligible people, which are older folks that qualify for Medicare or folks on disability and Medicaid. So generally pretty sick people that also have something called social determinants of health, which is one of the bigger topics that we'll probably talk a lot about actually during this conversation. But yeah, during that training, that really got me into that space and fighting for people that didn't have access to healthcare, period, much less high quality healthcare. And I like to think we were giving high quality care, and that's what we were trained to do. But that job then led me to Atlanta in 2016, where
jumping again. Jumping again.
Exactly right. So this time it was work that took me to a company called Ira Health. They were a Boston-based health startup that was working in the space known as value-based care, and they took it a step further and called it relationship-based care.
Okay.
So it wasn't revolutionary in the sense that we were doing anything different from a core perspective, because what we were actually doing is what healthcare and medicine used to do 50 years ago, 60 years ago, and actually create relationships with your patients.
Which is very key.
Absolutely.
You want to have that connection.
Yeah. And if
you want to trust your doctor.
Exactly right. Yes. If you don't have that trust with really anybody that you're talking to on a pretty intimate level, then you're kind of missing the secret sauce, so to speak, in terms of
I like that term, secret sauce.
Yeah. In terms of being able to really affect both the people you're standing there and sitting there with, but also, I think, the larger population in general and public health. And you got to trust the people that are giving you the advice. But what that role with IRA taught me was that healthcare didn't have to be the way that most people, unfortunately, experience it, which is something called fee-for-service medicine. Fee-for-service, if you break the term down, it pretty much means that a medical institution, so let's say just a regular doctor's office, they make money via the amount of time they spend with you, but also the type of care that they're giving, like what they're doing during the visit. And this business model, which is exactly, unfortunately, there's another way to describe it. This business model really incentivizes people to get more and more patients in any given time.
So you're missing out on that connection because you're trying to go faster and faster and faster.
Exactly. And not dissimilar to the way kind of our public society has been going over the last 20, 30 years now. It's just everything moves faster and faster and faster. Actually, it's probably more than 30 years, to be perfectly honest. But my experience with it has been over the last 45 years. But it really disincentivizes people or doctors in particular, from spending time and actually getting to know people.
Yeah, you're disconnecting yourself. You're going in, you're just thinking about the paycheck, and you're thinking about how can I be able to raise my, equity.
Mm-hmm. And that's the rub, is that the doctors, a lot of the time, even the people delivering the care, the providers, and that can span from physician assistants to nurse practitioners to medical doctors like me, we don't often see that in terms of like equal money, if that makes any sense.
Okay.
We're making money for the organization, which then pays us. Now there are different payment schemes, and how it's complicated to a point where it's hard to understand even for people that are actually in the space. But ultimately what it means is the more people that you can see per hour, the more money the organization makes. And it's generally the organization that strives to make more money because it is a business. And,
so your pay scale could change depending upon how many patients you're seeing.
If your organization pays you like that. There are so many different terms for this, but ultimately that's one way to do it.
Okay.
But again, it disincentivizes spending more time getting to know your patients. So I was attracted to this other practice model, which at the time was less common. I was always attracted to those non-mainstream primary care practice models.
Because you're a caring individual. That's the big key thing there. You care.
I really appreciate that. Thank you. In trying to, and that's one thing on a sidebar. If you're going into medicine, so this is for all those medical students out there or people wanting to go into this level of care, don't do it for the money. You can make a ton more money doing things that are doing something else, but this is just the hardest possible way to do that. So it tends to, especially primary care, it tends to filter out folks that are in it just for the money, because ultimately on a pay scale standpoint, like we're at the lower end of that.
Okay.
But that's, again, it's not the reason any of us did this. Sometimes it's because our culture and our heritage say that is the
That's what you're
appropriate.
supposed to do.
Yeah, that's what you're supposed to do. So my brother became an engineer. I became a doctor. So that was
You fulfilled the family's needs.
exactly right. But having said that, it does behoove us to be, I mean, ultimately primary care. In particular, and now I'm biased when I say this, I think it's one of the most important specialties because we actually are generalists. So I am good at a lot of things. I am not great at really anything. And
The
that's
master of none, but the curiosity of many. Yeah, something I like to say.
Exactly right. Because we have to be that in order to get a general idea of what's happening and then understand where we can dig in. And this all goes back to that relationship-based care, that value-based care that Iora Health taught me, is that we have to get to know somebody first before to really understand what to do about a particular situation.
And they have to feel comfortable with you to open up in that.
Absolutely. Yeah. There is so much I've discovered in my practice where I just spend an extra 5 minutes asking, or less, asking about their lives, especially on new patients. When I take a history, I like to know, like, where do they live? Is it an apartment? Is it a townhome? Is it a house? How old is that house? How old is that building?
Yeah, because that makes sense of, you never know with mold, or you dealing with, like, what kind of fumes are around your areas for what you're breathing in.
Bingo.
For not radiation, but what's the word of underneath your house that comes up? Radon.
Yeah. Carbon monoxide, the whole thing. Like, is this a 150-year-old house in the Hudson Valley in New York where the walls are plaster and it's got lead-based paint? They have a fire-based furnace that's spewing out carbon monoxide everywhere, and they don't really know it. So yeah, all of it's really important. I've had patients where mysteriously suddenly develop allergies, and the common misconception is that, well, Georgia, lots of allergies, and it's just been getting worse, which is not an unreasonable conclusion. But I asked a little bit more, and I found out that this person and their partner were renting a 100-year-old house, and they didn't know how old or when things were retrofitted for.
So you could have asbestos or the old ventilation, not ventilation, but insulation and stuff in there that could be affecting it.
Yeah. In fact, they did discover that they implored their landlord to have a professional mold inspection, and they discovered a lot of mold in the walls and that were encroaching on the ventilation system, and they ended up moving, and that person, without really any other intervention from me, started to get better.
And sometimes it's just the smallest little changes.
Yeah.
But your atmosphere, oh my gosh, heavily affects you.
Yeah, absolutely.
What is, like, Arizona or out west? A lot of people that have arthritis move out there because it's less stress on the body for something like with the humidity or something like that. I can't think of.
Yeah, barometric pressure differences, all of these things actually matter. Now, it's our job to figure out how much they matter and what things are really truly affecting things in the most likely scenarios. There's a term we used in school called, if you hear hooves, think horses, not zebras.
Okay, so I'm curious.
So it leads you to think, if you think about the thing that's most common, right?
Okay.
So you hear hooves, it's probably a horse. But if you think about, it could be a zebra, so that's not as common in the United States, right?
True, unless you're at the zoo.
Right, exactly, unless you're at a zoo. So the idea is that we think about the most common things that could be causing something. But after we exhaust that list based off of our workup, our history taking, our exam, everything like that, then we start to think, is this something that's less common? The internet is a vast and wonderful resource, and also the scariest place on the planet.
Yep, WebMD is scary. It is a scary thing.
Yeah. The resources have gotten a lot better now in terms of filtering out things that are wildly untrue, and large healthcare organizations have gotten really good at leveraging these resources. So I actually love it when patients look stuff up and come to me and say, hey, I read this online.
What are your thoughts?
Yeah, exactly. Like, what do you think about this? Like, I know, and it's funny, everybody...
Because sometimes they're actually giving you symptoms that you didn't think about originally if they've kind of done some research.
Absolutely.
Yeah.
it leads to better public health education, but it's our job to also filter out the stuff that is less likely. So
True.
I give that saying, that analogy about the horses and the zebras to my patients too. It's like, when you read this stuff, think about the stuff that could be most common. So critical thinking and being able to analyze data just in our lives, I think
True.
is really important in the larger scope of thinking about health equity, health inequality, things like that. So actually, that leads me to
what's the key thing of there? What's the difference between equity and equality? What's the difference there?
Yeah. So equality, what it aims for is so everyone can have the same thing. So in terms of healthcare, they receive the same treatment. Health equity recognizes that some people or larger populations need more support or different types of care based on their specific needs or circumstances. So that is referring to things like social determinants of health. So what those are community resources, just how much money somebody makes, where they live in relation to that, what their environment is, like, the aforementioned example about the 100-year-old house, right?
Exactly. If that's what they can be able to afford.
Yeah. And if, most people remember the healthcare marketplace, in fact, it's still around. But back in, I think it was 2012, was it 2015, something around there? Yes, yeah, because we were working with it. We were heavily working with the marketplace eligible patients. So these are folks that either don't have employee-based insurance plans or can't afford private insurance. That's, just ridiculously expensive if you try to buy it on your own.
True, yes, it is.
Yeah. So government
Cobra, stuff like that. Oh my gosh.
Exactly.
Whew.
So government-sponsored or government-subsidized programs, like the healthcare marketplace, provide an avenue for people. It's better than nothing, but only just. It's the feedback I've gotten from a lot of patients.
Okay.
Now, it really depends on your state, because all of that is at the state level.
Huh. I didn't think about that.
There are larger, so Medicaid is ultimately it's a government-sponsored program, like a national government-sponsored program, but the state governments have a lot of say in the type of eligibility that people like. So they have a say,
like a gatekeeper in a way.
Yeah, and they can expand Medicare access to people by saying, well, you don't have to make, you can make a little bit more money but still qualify for this annually, or you don't have to have, like, you can have pre-existing conditions or not. So a lot of the time when people are seeking healthcare, it's not because they are healthy, it's out of fear of getting sick.
Yeah, this
also,
is true. Yeah,
because you are sick and you need healthcare.
And that's decided at the state level, you said?
Majority of it is, yes. So these programs, and based on my understanding of it, these programs can get pretty complex in terms of where funding comes from and how much people have to pay in order to access services. But that all ties in also with and this is why I mentioned this, the pay scale or the payment systems.
Oh, yes.
It ties into how much reimbursement a provider giving healthcare, and this could be anything, a hospital, anywhere from a large hospital system in a major metropolis to a single private practice primary care doctor running a micro practice with just 2 people in a rural community. If they take Medicaid and Medicare, then they get a certain amount of money to care for people.
Okay.
But it depends on how it's billed,
which is a whole long process. Holy moly.
Yeah, it's a complex process.
All the codes.
Mm-hmm. Yeah, and that's the thing. So the incentive is based off of that to provide care to people that need it. But also, in order to keep a business open, there has to be a certain level of reimbursement there, right? So
true. Bills don't go away.
Yeah, it's a very fine balance there. So in the larger scheme of things, when we think about equality, that means everybody gets the same thing, right? No matter what your income is, no matter what your station in life is, a CEO of a large corporation gets the same type of care as a person living in a community of 500 people. Well, let's use Larned, my hometown, as an example.
Yeah.
Like, as somebody living in Larned, making minimum wage, at an hourly job. But unfortunately, the U.S. doesn't work like that. Not in an ideal sense, and not in a large scale, certainly. There are little pockets of that out there, which is where IORA primary care kind of drew me in, is because we work directly with people that are on the marketplace and needed this kind of care. But value-based care strives to narrow that gap.
Okay. Yeah, definitely agreed. you gotta find that line.
Yeah, and when we say value, it means like how effective are our treatments? So we measure it based off of how well our certain patient population has their blood pressure controlled. How well is their blood sugar controlled in the sense of, in the case of diabetes or risk of diabetes, weight, if they're smoking or not smoking, and how well are we at getting people to quit smoking?
Yeah, that's a challenge.
Now, it's not just us that can do this, right? It's not at a community level. It's at a social level. So a lot of things affect it, but it's about giving that high quality care to people that really need it. That ultimately, man, I wish I didn't have to take it all back to economics, but it really
economics. Unfortunately, the money makes the world go round.
Yeah, you're absolutely right.
It's really sad when we think about it, of the opportunities that are just completely pushed away because you don't have that financial capabilities of doing so.
Yeah,
compared to that CEO, what they're able to buy from their groceries compared to the person in Kansas trying to buy their groceries on it. There's not a comparison of what they can maybe the CEO can afford to cook,
right?
And the other one's just, hey, we got pork and beans tonight, and that's what we've got because that's what we can afford.
Yeah. And then actually using that exact example is what's the quality of food that people are eating.
That makes a huge difference because your nutrition will decide on how your brain processes and how you're able to think and what you're able to do. There was a friend of mine who did a study on that from third world countries to first world developed countries of how economic decisions and stuff were made based on the fact of food, nutrition.
Yeah, it is a massive part of, I think, the way healthcare has changed over the last 4 decades. The food quality standards in the United States can vary wildly.
Oh my gosh, yes.
Compared to European nations or hell, even Hawaii, which is, a state of the United States.
I'm going to use the example Fanta. If you ever buy Fanta in the United States and it's like the vibrant, like orange, neon orange, then you go to Europe, or everyone's going to use England or Ireland as an example. It's a light, natural kind of color that has a little bit of the actual pulp still in it.
Right.
Like they're drastically different.
And if you look at the ingredient list, you know exactly why.
Exactly.
So I tend to do this and go off on a tangent with the original question, but the definition of health equity versus health equality is just that. It's recognizing that the disparities exist, and that's the space that I've devoted a lot of my career to, and has given me probably several ulcers over my career and sleepless nights. That's my own problem to deal with. But
sleepless nights can come from multiple things.
That's true. But having said that, I think there are more people now, and people that can make, like, change makers that can actually do good in the world. And what they are trying to do is make the value-based care and health equity part that a profitable business. That's the secret.
Capitalism wins at the end of the day.
It does. So we have to play the game.
Yep.
Otherwise, somebody else will come in and be able to deliver some type of care that's cheaper, and that incentivizes insurance companies to reimburse those providers better than they would other ones that maybe don't have as good outcomes but can't see as many people. And so really so the light at this tunnel is that there are organizations out there that are pursuing this and really trying to make a difference. There are large ones, actually, that in my career, I've worked for multiple companies through acquisitions. So the larger fish eats the smaller fish, so on and so forth, way up until most recently, Amazon One Medical, which
That scares me. I'm not gonna lie. Amazon getting into the medical field, like they're in everything.
It does, and I've gotten similar feedback, and not to badmouth my former employer, but I've had patients tell me that something similar. Like it's something that's hard to wrap your head around, a retail company that is getting in the healthcare space. Now, one thing I will say is that the reach and the access to medicine has changed so dramatically with technology. And I do think that Amazon has that. They have the resources and the technological acumen to be able to do that, just like One Medical has been doing for a while now, for years. They are a California-based health company that has been doing something similar to Iora. In fact, so much so that One Medical grew really fast and then acquired my former company, Iora. We were working in the when we were working for Iora Healthcare, we were working in the Medicare space. Medicare and Medicaid, actually, but Medicare primarily. So folks that are over the age of 65 and have particularly distressing health conditions. So multiple things happening all at once. So diabetes, kidney failure, liver failure, on top of an aging body and generally aging population.
And how you can be able to how your body reacts is going to deal with your age.
Patient of mine, actually, a patient's daughter had described it like all these things are now crashing into each other. And I still remember that description.
That's a good, that's a good description.
It is. But we were working in that space, and One Medical was working in the kind of general population from kids to adult space. So they acquired Iora because we had a system that we were able to address these very, very sick patients and their care needs because, and here's where the economics comes in, because these folks are so sick, they were using it was of our patient population, they were about the top maybe 10 or 15% of our patient panels were responsible for 70% of the total medical expenditure for a healthcare organization. And we were pretty big. So what that means is a very small population are so sick that they're using healthcare resources way more than the general population was. People that are younger. And it's not because, it was because of a lot of different reasons, but one of them is just they didn't have access to good primary care to be able to be that generalist. So they were spending more money going to specialists when a primary care doctor could have managed a particular condition earlier on before it got to
it accelerated. Yeah.
And certainly before it got to the point that somebody had to go to the hospital.
Which is scary to think that you can't go to a primary care physician to get started on something right whenever you start seeing the symptoms. It develops, and that affects a huge large of the marginalized community.
It really does. Yeah. And so we were doing that, and we were starting to do that pretty well. It wasn't a venture that was wildly profitable. In fact, I think it was a while before we were able to turn any profit. We were privately funded. It was investor backed, but once One Medical bought that, what they bought was access to the senior space and being able to manage that portion of healthcare because the federal government had started to work with companies like Iora and other ones in the nation that were doing value-based care because the outcomes were better and we were saving money. And that was the key thing.
Saving money. Yet again, the barrier comes back down to money at the end of the day for that. Is there any other barriers that you notice from people within these marginalized communities of not being able to get access? Because I could go to a family care physician right now and get a reference to go say, I've got a foot problem. I could be able to go and they go, okay, that's refer you to go straight to foot doctor. Okay, cool. I get there. We're at the specialist. And then maybe they're like, oh, well, maybe we're going to go ahead and we may have to do surgery. And they recommended me to another specialist. You were saying that earlier, people were just going straight from skipping the family care physician and having to go straight to the specialist. Yeah. Is there a barrier that you think that could be addressed kind of in a way, maybe?
Yeah, I'm glad you brought that up, actually. I will answer the question starting off with a question.
Carson with a question.
Yeah. How would you get there? How would you get to the doctor?
Well, first call and make an appointment. Okay, after making the appointment.
No, I mean like physically how to get there.
Oh, by car, transportation.
Yeah. So you drive yourself there.
Yeah.
Yeah.
Or catch a bus.
Or catch a bus. Exactly. So for a lot of these very, very sick folks, even that is something that takes days of planning.
That's true.
If at all. It relies on a quality public transport system in the community that they live in.
Never places like in Atlanta or a major city that has transportation going around picking you up.
Yeah. And it's not ideal for those of you that live in Atlanta and have lived in places like New York City. There's a wild difference.
Oh, yeah,
in
of
efficiency
access.
and access, right? And, New York was built on a subway system and train system, public transport that allows people don't have to have cars.
Yeah.
Whereas in Atlanta, you kind of have to have a car.
And I feel like they just gave a kid a crayon and drew out the highway system.
It does feel like that. So that is one of the social determinants of health that we had identified early on is transportation to the doctor. So a lot of times people just couldn't get out of their own house because of a physical disability or not owning a car, not being able to drive anymore because their vision is degraded.
Oh, yeah.
Right.
Yeah, exactly. To be able to, you got to safely get from point A to point B.
So, multiple companies were doing this that were in the value-based care space. They were actually offering transportation as a part of their benefits package.
Oh, I like that.
Yeah. And it was a part of being a member or being a patient of that particular office or that particular company. It wasn't something that the insurance companies were doing. They were doing it in.
So it's not being widely advertised in a way.
It was for us, meaning that we want you to come see us. So we're going to make it easier for you to do that. We're going to send you a car via Lyft or Uber. There are other services that we partnered with, but ultimately we're sending you. We're going to send you a car for your appointment time, get you here on time, and then we'll take you home, or we'll send you to a specialist if we deem it necessary. And it was working really, really well because people that hadn't been to the doctor in a decade now all of a sudden had an appointment.
Yeah,
had an ability to get there. Somebody's going to drive them, right? And they got to see their provider. They got to see. In the context of IORA, they got to see a health coach that was helping them navigate the system and talking to them about all those social determinants of health and really digging in and asking questions about what's your life like? What do you do on a daily basis?
Yeah, and giving them the resources.
What's in your fridge? What's in your cabinets? That sort of thing. And then they're able to get home and actually kind of work on the things that they know they can change, that we can identify that's possible to change. But there's a problem with that. Yeah.
Okay.
It goes back to the economics.
Yeah.
It is very, very expensive to do this.
I can believe that because if I know getting an Uber just from down to the airport from here in Cherokee County is like almost $75-$80.
Right.
And but again,
non-surge pricing, right?
Yeah, exactly.
Yeah. So that was the thing that had to change for a lot of companies actually, where they originally started that process and it was working really well, but from an economic standpoint, it was not sustainable. So eventually we had to dial it way back and then ultimately had to remove that resource.
Which is unfortunate.
Yeah. Now, to some insurance companies' credit, and these are ones that work in what's called the Medicare Advantage space.
Okay.
I won't go into the details there. You can Google it.
Yeah, that's a whole other podcast in itself.
Yeah, exactly. But they were offering transportation to appointments, but it was via a multiple person, like a bus or something like that, like a small transport bus, like you see at the airport shuttles. So something about that size.
Okay.
So you had to at a minimum of 3 days, oftentimes, to make that appointment to get picked up, and the timing didn't guarantee that you're going to get there on time. So more than likely, you would have to get there either an hour early or 2 hours late. So people would be.
So it was inefficient in that way.
It was inefficient. Yeah. It was something that's better than nothing.
True.
But it often discouraged people from actually using it because they had trouble really predicting when they could actually get there. And this is assuming traffic behaves itself, which
it's especially when you're in Atlanta, you never know what you're going to get.
Exactly. Yeah. And to our listeners that live outside of Atlanta, distance is irrelevant. It's time. That is how we measure how to get to someplace.
Yep, it is.
So yeah, it took me half an hour once to go 3 miles. But so anyway,
We digress.
we digress.
Traffic.
I know, right? Yeah, we can do another topic on that. So yeah, one of the big disparities that we noticed was just being able to get to the doctor, and it was remarkable how people were able to really engage. Like we were literally able to engage with them. Now, one part of my career involved working with I had mentioned very, very sick folks that having multiple conditions crashing into one another.
Okay.
So much so that they literally couldn't leave the house, even if we did provide transport.
Oh, wow.
Right.
Just because it's that detrimental. Yeah.
Correct. Yeah. Like it would cause more harm to get them out of the house to go to a place. So what do you do in that situation? Virtual care comes to mind, but it has a lot of limitations.
It's true. You never know if that person actually has access to internet or anything in their area too,
Exactly.
or understands how to use technology in that way.
Another social determinant of health, 100%. So we had a team, they're called high risk programs, which was that was the name of it in our company. But I was part of that group that we actually had home-based teams. So a nurse practitioner,
Okay.
a highly trained nurse practitioner in geriatric care was able to go out to homes and be able to actually see the person where they are, like literally meet them where they are.
Which is huge. That's something you don't find anymore.
Right. And the good news is that model is still out there. It targets, and I use the word targets because that was just, it's the language around the management of these sorts of things tends to depersonalize it. It's the way we talk about it sometimes. So forgive me if I do that. But what we were trying to target was a population of people that were using a lot of healthcare dollars. So because somebody, say for example, I couldn't leave my house because I had such bad heart failure that I got short of breath walking from the couch to the bathroom. And sometimes maybe I couldn't even make it to the bathroom. If I got to a point where that got even just a little bit worse, I would probably call an ambulance.
Yeah.
So then an ambulance would have to come and pick me up and take me to probably an ER or something to that effect, right? That's not probably, that's
what's going to happen.
That's probably what's going to, that's most likely what's going to happen. They would triage you here in the house, but ultimately they would ask you if you wanted to go to the emergency room. And then that process for anyone that's had to take an ambulance is unbelievably expensive.
Yes.
If you ever got a bill from emergency transport, it is mind-blowing.
Thousands of dollars.
Right. So even though a $70 Uber taking somebody from a rural area down into the city is less than that.
Yeah.
So that's where the money savings was coming in.
There's actually been, I can't think of the name of the company that actually does medical transport like Uber, which is kind of cool.
Yes.
But they're not going to pick you up if you're bleeding to death. It's just one of those things I'm like.
Exactly.
Yeah.
So for non-critical, non-emergency transport, there's a whole bunch of levels of transport services that are available out there. It's just understanding where they are, how to
That's trying to find it.
That's where people like healthcare navigators, I think, are great. So that's one of the folks that we had, one of the roles that we had on our teams were health navigators. So basically they were able to sit down with the person in their home and tell them how to get online and make an appointment, or would literally call the Medicaid office and sit with them on hold because they were unable to do this on their own.
Yeah, good advocacy. That's awesome.
Yeah, it was a very time-intensive and expensive process, but ultimately what we figured out was it was, in the end, creating better outcomes for people. People were getting healthier. Not only were they not getting sicker, they were actually getting better.
Yeah.
Because they were able to access care. So somebody could...
Half the challenge is understanding. And that's huge. Like, I know it defers me away from doing stuff. If I can't understand it, I'll try and try and try. But having an advocate or somebody that helps you navigate it is huge.
Right.
Like, that's awesome.
Mm-hmm. Yeah. And given how fast technology moves and how much healthcare uses this technology, it can leave a lot of people behind from a technology literacy standpoint.
And we move very quickly.
Yeah,
we do.
And there's also health literacy, just understanding what your provider is saying to you.
Oh, yeah, that's true. The lingo, you get left behind heavily.
And that's on us to be able to explain and educate the general population. I think one of the most important things about healthcare in general is public education about healthcare. So making sure that the folks that you're working with understand the why behind what you're recommending and the why behind what's happening in that moment. Like even as simple as you have allergies. This is why it's happening. These are
what you can be able to help avoid this.
Right, exactly. And that leads people, as long as you treat people like adults, assuming they're adults.
Treat people like the people.
Yeah. Treat people like people. And
not like they're $1.
Right, exactly. And certainly not the next person in line for the thing. People tend to be able to extrapolate that information and apply it to other things. So it generally leads to a better educated, healthier population, which that's the ultimate goal.
Yes.
Yeah. For you Star Trek fans out there, the whole Star Trek world universe was explained really well in Star Trek First Contact, the movie. So Jean-Luc Picard, the wonderful Patrick Stewart, explained this. They had traveled back in time, and somebody was asking one of the people, they had brought one of the people, these colonists on Earth, up to the Enterprise, which in that movie, it was a Galaxy-class starship.
Oh.
Very fancy. This is the one with the holodeck and all that stuff. But anyway, I digress. That person asked the captain, how much did all this cost? Because for them, scrounging up enough titanium to make just a small cockpit in an aircraft, what took years.
Yeah.
So what Captain Picard had explained was that money has no object in our society, in the world that we lived in. It was the 23rd century, right? What we realized, and what they had realized actually after first contact with an alien species, which in this case was the Vulcans, it had changed the minds of so many people where they suddenly knew that they were not alone in the universe. And the pursuit of money, of power, of more didn't make any sense anymore, and it wasn't important. The betterment of humanity was what was most important now, and everything just changed. Now, I admit, this is pie in the sky, but that notion of a society that thinks about humanity first and what are we doing for the betterment of the world and the people on it.
Leave the world a better place than you found it.
Exactly. Yeah. So that I remember the first time I saw that movie, I was like, it was I think I was in high school or college, but I still remember it,
Yeah, because it's so impactful, because it's reality of what we were looking for, a desire, a goal.
Exactly.
And that's huge. And a lot of that comes to leading to my next question of policy.
Yeah.
Like, that's a huge thing of like, what are some healthcare policies that have affected this? Because I know we've gone through the healthcare market, and then each state, as you said, kind of can make its decisions on how healthcare can be able to be funded in certain ways. Like, what policies are out there that kind of helps with this equity?
Excellent question, and I'm not going to pretend like I know each individual policy because
just in general, like just a different one. Like, it could be one specific one. It's just like,
so
you don't have to do a ton of them.
Well, I think one way that I can answer that is thinking about kind of the larger scope in terms of state level taxes, right?
Okay.
So our state representatives, they lobby for their certain districts, right? And their constituents, the people that voted them into office, because they are like-minded and they represent people in that particular community. So they lobby government to get resources because, the federal government has a certain budget that it allocates for certain things. It has a military budget, which is massive. It has a general healthcare budget, which is not as massive. So the general policies around how we spend our money, when I say we, what I really mean is the federal government and the state governments. From my perspective, we should be spending the most money on healthcare and education, but other priorities exist. And money, even though it seems like it can be unlimited for governments, it is decidedly not. And there's a certain amount available, and it has to go to different things. And unfortunately, education and healthcare are often deprioritized for other things like infrastructure, which is also very important. And so there can be you can make the argument for all the things that we spend money on, that the government spends money on. But at a state level, even at a small government city level, we vote people in based off of what's important to us, right? And if those values align, like, for example, I vote for people that value healthcare and education.
Because that's your sticking point.
Right, exactly. If I had to pick a short list, that's it. There's a lot of other stuff, but
that's a high priority.
Yeah, exactly. So from a health policy standpoint, that's where it really starts, is city government at the smallest levels. Heck, even thinking about your school board, right? Who's the superintendent, and who is helping to dictate what's going to happen to their larger population.
That's fine. Voting your local elections matter.
Yeah,
so much.
So it's advocating for the people in my constituency are very sick and they don't have access to healthcare. I need this amount of money to be able to provide this level of care for them. We can only do so much in our local government, so we'd like more subsidies from the U.S. government or from the state government. So there are a lot of, I think every policy affects the other one, because ultimately, if something gets voted in that is a part of a federal or a state budget, that money is allocated for that thing.
Yes.
Right. So the more that can be allocated for public education and publicly available healthcare, that's government subsidized, whether that's state level, whether that's city level, state level, or federal level, matters.
Yeah, it does. Yeah. It's huge. Right, that is, and something that comes to my mind is cultural competence as a result of that. And I'm not trying to say, trying to put everybody into boxes, but we naturally put people into boxes here, unfortunately. Like, how important is cultural competence and delivering equity healthcare? Because that can come back down to voting in your district as well. Mm-hmm. What is the majority population there? Are they predominantly African American? Are they predominantly Indian? Are they predominantly of different Hispanic backgrounds? There's
So the cultural competency, and I think the cultural differences,
definitely.
I'm think of it like that. Yeah. There's a lot that I think
that's better wording. Yeah, your wording.
Well, also, I want to put it this way, is I think there's a lot more that binds us than separates us, but that there are obvious cultural differences, like you mentioned. I think the values that communities place on the things in their lives. So we're on the healthcare subject, so we'll talk about healthcare in that sense.
Yeah,
I think as a community, and in your sense, depending on if you are part of an African American community, if you're part of a Southeast Asian community, a Hispanic community, how much does the health of your community matter to you, and how much is it important to you that resources are allocated for that? So a lot of it is just understanding how important healthcare is. So this kind of goes back to the public education and public literacy around healthcare. So health literacy.
Literacy, yeah.
Yeah.
Wish we had class dedicated to that in school.
Yes.
That'd be awesome.
Exactly. Same. So it's funny that you say class, because and speaking to a teacher, please forgive me, I kind of consider myself an educator.
You are.
When somebody sits in the room with me.
You are.
I give them as much education I can about the thing that we're talking about, and stuff that's adjacent, so they can take that information and use it to their advantage in their lives. But ultimately, that's what teachers do.
Yeah.
Is that we tell them we tell people things that they didn't know, and let them think about that and use that
extrapolate.
information. Yeah, exactly. All information is good. It's what we do with it that matters.
That is extremely important right there. There's so many, like, I could go on a huge long rant about what classes we need to have, like, in our school systems that are just general life skills that we're missing out on.
Yeah, it's home economics was the traditional thing back in the day, and it's just funny that term is even more relevant today, I think. But I think, a lot of it is like how to use a stove, cooking, and things like that.
Doing your laundry. It's like, dude, we need classes to again reminder of how healthcare works, how to navigate taxes, how to be able to they took driving school out of schools. Like, I get that's a whole other issue, but not everybody has access to being able to pay for driving school. Like, give us all these different stuff here.
Which, if we take it back to Atlanta traffic, you may, it's easily to relate to that given the insurance rates, car insurance rates in Atlanta.
Yeah.
I remember when I first moved here, my car is still registered in Kansas. Don't tell New York State about that. But when I moved here, I still had a Kansas policy because that's where my parents had lived, and that was the home base
of the cars.
Yeah. But the insurance agent at the time, so this is maybe 2016, had told me that the insurance rates in order at that time, the highest was LA, number 2 was New York City, and number 3 was Atlanta.
Makes sense.
Right.
Makes sense.
Yeah. And Kansas, no place in Kansas was even on that list as an expensive place to insure a car. But the number of accidents that we have and how good the accident response system is here definitely shows how education is important and just how to do a thing, right?
Yeah.
How to do a thing the right way. And then, it varies wildly. And you can use that analogy, actually. Traffic and traffic accidents and traffic congestion, it all can relate to healthcare and health education and health understanding, as we learned pretty abruptly and severely during the COVID-19 pandemic. The disparities in healthcare were wildly apparent.
Oh my gosh, yes. And that came down to a lot of it is education.
Yeah.
Like, what was the opportunity available to? Like, we saw buses and high Wi-Fi hotspots being put out for kids that don't have internet access to be able to go and do stuff like that. That was a organization taking an effort there to be able to do that.
Right.
And that's thing I'm curious on, is there some organizations that are out there that are actually like being able to help advocate for this for people, like in these different communities?
Yeah, a lot of local programs, and this is at the city and county level. And if you have access, obviously, if you have access to the internet, looking this up online is pretty easy in the sense, think about a service that you want. So I'm going to use I'll use like an easy example that I used when I was in school was I wanted to exercise more because I've heard it's good for you.
Yeah, I agree. Get a gym membership or find some equipment in your area to be able to work out.
So the local parks and recreation department in Lawrence, Kansas, where I went to undergrad, had exercise programs and exercise classes. And you paid, I think it was a nominal fee. It was way less than any gym membership anywhere in the world.
Nice.
Or anywhere in the country. But it was taught by just folks in the community that they didn't volunteer their time. They get paid like a small amount, but definitely not to sustain income.
Yeah.
But
they care. They want to give their time to be able to make that resource.
Yeah. So I was a part of a small exercise group that was run by this wonderful woman who she in her own right is an athlete and has a lot of education around physical health and physical well-being. So she was teaching the course, and it was really nice. She did it on multiple levels, depending on anybody at any
meet you out where you're at.
Yeah, exactly. Yeah. And we were all together, so we were all motivating each other for the folks that weren't as good at a particular thing, but it was a sense of community, and I think
that's huge.
Yeah,
and community is so important.
And I think that's where, to your question, where like what organizations are out there, there are a lot of them, surprisingly so. I'm a member of the Decatur Family YMCA, and that membership has been great for me. I would like to go more, but that's again part of my journey.
We're all trying to find the time.
Right.
Time is only so much.
Time is finite.
Yeah.
Well, so to answer that question, there are many things but looking at the local level, and that's where
So start at like your city, county website, and then maybe be able to like kind of dig from there.
And search for, and a lot of times I help my patients look for programs, and oftentimes this is what we were doing for our senior patients. Is we start
spend the time.
We start and help them search for companies that could, or organizations and programs that are available to them. There were tons of senior focused programs. Yeah, tons. There were senior focused programs that were widely accessible to people.
Okay.
Because they were part of a city budget or a county budget. And some of them were, that come to mind were day programs for social interaction for folks with Alzheimer's disease. So these are people that were kind of in early stages of kind of the less Alzheimer's is such a devastating disease.
Yes.
And the disease course is varied, but ultimately things end in the same way, and people become so debilitated that they're not able to even have their basic needs met. But a lot of time it's social isolation, which again we experienced. Nearly everyone in the country experienced, everyone in the world experienced this during COVID.
Yep.
Right.
That was a huge one.
So if you can imagine, as you get older and into your 60s and 70s and 80s, not having the community around you because your friends may have died already.
Or your family moved away.
Yeah, exactly. So having that social interaction it's research proven that it improves overall health, general health outcomes. Is a sound mental health is part and parcel with, am I using that term correctly? It works directly with your physical health, and being socially isolated is very isolating.
Yeah, it's hard. That's when we look into retirement age. Whenever people retire, the age of them dying sometimes is high because of everybody's got to be somewhere doing something. And if you don't have that affects your health of how you respond to situations. And that's something that has been challenging for me recently, of just being able to find activities to do and find something to do that creates a purpose more than work. Because if we satisfy so much of who we are as an individual around work, because that's how much time we spend in a day is there. But the reality is your work doesn't define who you are.
Right. Yeah.
But you got to be able to find that community, find that space in order to.
Yeah.
So I can go on a whole long rant. I digress.
No,
but it does affect your health.
It is
like
so
heavily.
Important. Yeah.
Because it decides on what you're going to eat. I feel like making a peanut butter and jelly sandwich because it's quick and it's easy. Or if I'm feeling motivated, I want to get into a cooking class.
Right.
I can be able to learn how to make eggplant parmesan or something like that. That's a little more healthy for me in comparison to that PB&J.
Right.
But you have to make sure that effort's there, but that mental health is part of that decision as well.
Yeah. There's quite literally, in fact, there's an example I can give you with the mind-gut relationship.
Okay.
So a lot of people have heard of serotonin and serotonin receptors in the brain, right? These are the happy hormones, happy neurotransmitters. So the receptors that are in your brain for serotonin are also in your gut. Which is, so that's kind of the mind-gut axis, your digestive health can directly relate to your mental health and vice versa, which is that's one of the major reasons oftentimes when people have what's called a nervous tummy or like a nervous gut, we can actually treat that with antidepressants, SSRIs, or selective serotonin reuptake inhibitors, because the receptors are effectively the same.
Interesting.
It's fascinating.
Yeah, that's certainly fascinating.
Because it's relatable. Because I get nervous, and my nervousness translates into a fluttery tum-tum. That is a medical term for anybody wondering. But
I love it.
Right. But yeah, irritable bowel syndrome is one of those things that oftentimes is treated with antidepressants. And it can help regulate the system, because ultimately our bodies just are we're a bunch of wires and goo,
Yeah, we are.
and bones. And they all interact with one another, just like we all interact with one another from a social standpoint. And if we take it all the way up to the 23rd century, when Picard was telling that one person about why and how society works in his century, it's that the betterment of everyone is the most important thing, and nobody gets left behind.
Like something that dealing with resources and stuff like here, we're looking into a whole new realm with technology. With the rise of like telehealth, how can you ensure that technology does not exacerbate the existing inequalities that are there?
Yeah,
because of technology is not for everyone. And that's, even though, yes, we're in an age where kids are now born with technology in their hands, but you have previous generations that don't use technology.
Right.
And if you're saying if you have to have a smartphone to be able to have access to telehealth, some people don't want a smartphone. Some people like to have in their flip phone still.
Yeah.
And also internet's not in everyone's home. And so how do we like address that?
Yeah,
something I'm curious on.
Virtual based care, telehealth, is one of the
It's amazing. Don't get me wrong. I love it. It's amazing.
I think it's one of the most
It's
amazing.
just hard. It creates equity and inequality. Like it affects that.
I think it's been it is one of the best inventions in a long time, but it's the use of it and potentially the inappropriate use of it that becomes a problem. To your point,
That's true.
People sometimes just don't even know how to operate the system to get to the thing to see their provider or to see anybody.
Exactly.
Mental health care is oftentimes used in this context, which is, I think, something is better than nothing.
Yeah.
And mental health care is one of the things that I try to prioritize as much as possible, not just for me, but in talking about it
as patients.
in talking about it with my patients. But access to mental health care is wildly difficult, and a lot of it has to do with available resources. Which then takes us back to the whole economics of it. Blah blah blah. That blah 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 is actually, and it like probably 4 episodes, I think.
Exactly.
Or 3 episodes. But I think it's a great resource, but you have to be able to optimize it for both parties, for the providers that are delivering the care via virtual care, and for the people receiving it on the other end. So my father's a retired forensic psychiatrist, and during his career, as telehealth was becoming more and more popular, he was asked if he wanted to start doing that as a psychiatrist. We lived in a rural community at the time, and eventually they moved to a bigger city where more people did have internet access to be able to provide care into rural areas that did have access to care. I did have access to internet. But his contention, and some of it was just around the tech itself, but his contention was that it left out a big piece of medical and psychological care, in that you miss out on certain senses. You miss out on the sense of smell. You miss out on, and even if it's video, you miss out on certain aspects of sight, because you can't see, like we're sitting at a table right now. You can see me from like the
waist, chest up.
Yeah, exactly. So, you can't see that I am furiously mashing this stress putty that you got me.
Yeah.
Thank you again.
I've got one as well. So,
and
it helps out.
Incidentally, I broke the first one my kid gave me because apparently I was squeezing it too hard.
I think there was sun heat involved in that one that caused it to slowly deteriorate.
Thank you for giving me that out. But you couldn't see
their posture.
Yeah,
Their posture. That's true. And tone of voice can come across differently in a.
Yeah.
Like I'm totally for in-person treatment. Like I'm one of those people that I like in person.
But again, something is better than nothing, and both people have to be comfortable with this and trust the platform that you're using to be able to get the message across both ways. And sometimes you just gotta. Sometimes it's a leap of faith, in that
it is.
We do the best we can. I have done virtual-based care for a lot of my career, so I'm comfortable with it, and I'm comfortable being able to use the resource to its maximum potential. At least I think I am. I can have people do self-exams in knowing the education behind why I'm doing what I'm doing. So it's not just me telling somebody, tap on your face in these areas, and they don't know why they're doing it. What I'm doing is I'm testing to see if you have what's called percussive tenderness along your sinuses, to kind of figure out if you have sinus inflammation and if we need to treat a sinus infection or something to that effect. So it's not perfect, because I would rather do it in person,
because you know what you're feeling for.
Right.
You know exactly and sometimes just touching someone's shoulder or touch is calming.
Yeah.
It helps them feel more connected to you.
Yeah.
And in that sense, that's human touch is a big thing.
Right. So by definition, we're removing the human touch aspect of it. But what we gain is access.
Yeah. Because as I said, people can't get out of their home sometimes.
Yeah, exactly.
And get in the capability of that.
Or it's not feasible to them to get off work to go to a doctor's appointment.
That's true.
So a lot of the visits that I had been doing in the past, somebody has their smartphone and they find they can get away from the actual work for about 15 minutes and go to a different room in their office or in their workplace, and we can do a visit right then and there.
Yeah.
And I can diagnose and treat to the best of my ability based on the information I have. But otherwise, it would have been this person suffering with the particular condition for however long it took, and this could have gotten worse and then end up in the hospital or
having to go see the specialist and having to go see all
and
stuff
then definitely missing work. Right?
Yeah, exactly. And your wage heavily affects how you're going to be able to do things, because if it affects, can you pay for food this month? Can you be able to pay for transportation in your car? Or are you going to get repossessed? Or you're going to get kicked out of your apartment? Like
exactly, and the stress around that.
Exactly, and that when you get stressed, that affects everything.
Yes, exactly. You and I both know that really well.
Yes.
So
yes.
But having said that, I think telehealth, virtual-based care should be incorporated into every practice at every level of. Like every size of practice should have that resource available, because it provides access. To my father's point, you miss out on a lot of different things, and it's more appropriate in certain circumstances than it is others. But I think as a whole, it's one of the best things to come out of the marriage of technology and healthcare, from a primary care perspective, certainly, is being able to meet people where they are.
Yeah.
And people to have access to the care that they ultimately need.
Yeah, getting access to for someone is vastly different from person to person and generation to generation. That's something that I worry about as I get older with how technology advances, because I'm like a little old man already of yelling at technology and doing stuff. So I'm like, I wonder, I need someone to help take care of me whenever this gets to that point of where I can no longer understand technology. But yeah. And there should be community classes that are just based back for helping people navigate some of these things.
There are.
Well, not in your major cities. There may be, but not in getting to the rural areas, or you get into the high poverty areas where it's not as easily to be able to get it. That's a disparity.
Exactly. Thank you for that. Yeah. Thank you for pointing that out, because this was based off of the communities that I live in, that are more within the city. But yeah, you're absolutely right.
And trying to find that, that's in something that with that is with organizations and education and stuff. What's something that I could do on my level or anybody's level that as a listener right now what can organizations do? What can individuals do to help advocate for better healthcare equity, in their commonalities, because that's in their communities and everything, because that's a huge thing, is what can we do? Because that has to come from us to then become a them kind of situation. And I know we mentioned on your local level of voting, right? That's a big thing. But what else can we do in between voting?
Yeah. No,
in contacting our representatives?
I love that question because it's so applicable, and it's like an action step. Like,
Exactly.
What do you do next?
What's you going to do next?
Yeah. So I really love that question. It's because it's an action step in what we can do. What it kind of boils down to is ask. I'm gonna answer this question with kind of a question.
Okay.
Is for people to ask questions. Question what you see. Question what you read. Do you trust the resource that you're using?
.org, .net, .gov,
Yeah, exactly. Yeah, and even outside of
is this a doctor saying something, or is
Right,
this
yeah.
just like
or
Jim
rather
down the street?
is it a good doctor?
Yeah.
Right? Do you have reason not to believe them, or do you have reason to trust them? Trust your instincts. I have a lot of many big decisions I've made in my life are based off of instinct. Sure, there's some logical,
And that's skills you've learned that you've been given.
yeah,
Yeah.
that's true. I've learned to trust that, and that was a learned skill,
Takes a lot.
right? But yeah, I think on an individual level, it's understanding that the information that we have out there now, we can't necessarily just believe. Just like you shouldn't just believe everything that I'm saying right now. I am telling you all this based off of my experience over the last decade in healthcare. And I like to think I know what I'm talking about, but go and research, look this stuff up,
Yeah.
understand where I could be. I could be wrong, and certainly
We're human. We're faulty. We forget things.
Yeah,
There's little
exactly.
gaps.
And also, there's so much nuance to every topic that
True.
it's oftentimes hard to distill down into like a one-liner. I think
True.
because we are in a world where we need information fast and we need it now.
Yeah. That's huge.
And distilled down as much as we can. I think it really is questioning, and not in the sense that you shouldn't believe. And I don't want to take this to a level where you question everything in your life. It's
healthy to question some things, and some things just trust.
And you can do your research. Find out what things are, and then find and this is why I love your podcast, Kate, is because you find subject matter experts and you just let them talk, and I love that.
Let it grow, let it go, man. That's the thing. I'm asking questions and I'm learning.
Yeah,
that's what's learning from friends. I'm learning from everybody.
Exactly. But I think that's really like what really boils down to not even just health equity, but I think in our lives in general. Just ask questions and try to find out stuff on your own, even if it's something complex. You always got to start someplace, and that someplace is usually a question.
Yeah, it usually is, and I like that you said you shouldn't just believe. And that's the thing. At the end of the day, we sometimes we look at our social influencers and we look at commercials and we just kind of. One of my friends used the line, "Silence is tacit approval," and it's one of those things. I'm like, how do you think we were able to get these inventions that we have today? Through questioning, through advancements in that way. So it's like, that's why doctors say, get a second opinion, get a third opinion, you know, and read about this. And here's all these pamphlets and here's all this different stuff to be able to help you understand what you can. There's many different treatments for just one thing. That's why medications are constantly evolving, because we've got different ways to approach or treat something. And get out there.
I like that term used, evolving, because that applies to everything that we just talked about. Also, is that this evolves, this changes over time, and that's science. That's education. That's everything. Because history is our guide.
It is. History can repeats itself a lot.
It does, fortunately and unfortunately, as we seem to be learning now. But it really is an evolution of what happens and the answers that we can have for certain things. That's a part of humanity, is that we grow, right? I am not the same person I was 20 years ago.
Same here.
Right? So exactly. So
that's a good thing.
I think, and that's the thing. It's like we become different versions of ourselves. And there's a lot of decisions I wish I wouldn't have made, or I should have made in certain situations. It's nice to, this is where radical acceptance comes in.
Oh,
nice
good old
to
radical acceptance.
Yeah, good old radical acceptance
If you
is
don't know what radical acceptance is, spend some time.
Yeah.
That's a whole entire podcast in itself.
Yeah, it's right. Like, so the nuance, going back to that. But I think when we realize that things can change and that's okay, that things feel more comfortable in that you don't have to fight against change because it is inevitable.
Yeah.
But also, it's how you react to that is where I think inner peace lies. Now we're getting philosophical, but
yeah. Well, so you just mentioned the idea of change here. Like,
yeah.
What is in your opinion, are some initiatives or like changes that you think that are needed in our society to be able to better the equity and equality?
Yeah.
Like, that's a question that is, we've mentioned education as being a very key thing. We've mentioned questioning things in getting involved in your local governments and all this different stuff out there. Is there anything else we could think of that maybe we've missed out on?
Yeah.
Or programs that you want to recommend to people?
Yeah. It's funny when you asked that, my mind immediately went to the big philosophical answer is that we ought to treat ourselves like just treat people the way you want to be treated.
Yeah. That's, we get in our mind and it's like, would you talk to yourself the same way you talk to someone else? Like, would you say these same things to someone else? But we are our own worst critics, so we beat ourselves up. But would you beat that another person up who had that same problem? Right. No, you would be tender and kind to them, understanding.
But to answer that question in the scope of our conversation, I think one big thing is early intervention.
Yes.
Now that can be applied to a lot of different things, including education, but identifying things early, like preventative care, preventative medicine is very, very important. And, your provider may tell you, we're coming up on like for me, it's colon cancer screening with a colonoscopy.
Yes.
Since they updated the starting age for that for people to 45, which I just turned.
Congratulations.
Thank you. And I do believe that knowing and seeing what I have seen in people throughout their lives. So my training was full spectrum family care, family medicine. So what that means is that I was taking care of people of women that were pregnant and doing all the prenatal care and then delivering the baby and then taking care of baby and mom and then ultimately the whole family over the years. And, that continuity of care is really important. And then a big part of my career has been working with the senior population, the aging population, and having conversations about and normalizing conversations about death and dying, hospice care, end of life planning. These are all, from the term is cradle to grave. And I understand and I've seen the context of health disparity early in life and health inequity early in life leads to much bigger medical problems later in life. And later can mean anything. It could mean
5 minutes, could be 5 years.
Yeah, exactly. But there's been one through line in the entire thing is that early intervention, early preventative measures are so important because the reason there is health inequity, yes, there are so many different social determinants of health, but I can't even count the number of times I had been seeing a patient and thought to myself, man, if I was able to have the preventative conversation 10 years ago,
what this could have changed.
Right? It's a lot of rumination in a way, but I think from a healthcare perspective, it very clearly outlines the importance of trusting science. Yes, asking the questions. But trusting the science and trusting the why behind what the recommendations are. And if you don't know it, if you don't trust it, try and learn. Try to get the answers to your satisfaction.
Always be learning. That's a huge thing as a society.
Right.
Always be looking to learn.
Learning. You're absolutely right. So yeah, it's a broader answer to your question, but I do believe that it's really questioning and understanding what you can do right now to have your future self thank you.
That's true. Oh yeah. Hopefully I always look back and say thank you to your former self for taking that risk or taking that chance forward.
Yeah.
And
just another plug, actually, vote in your local elections, the small government stuff.
They matter a lot. And write your representatives.
Yeah.
Like they're there for that they're representing you.
Somebody reads those. It may not be the representative themselves, but somebody on their staff reads these things and they matter.
They do.
Yeah.
So we've discussed a lot of variety of things here, and some of these topics could be turned into multiple episodes, which I'll have to circle back to that at some point of getting you back on here to discuss some of these other topics. Are there some things that you would still like to be able to cover that I perhaps overlooked that you think need to be a part of this episode?
What's nice, and I think we touched on it several times throughout the episode, is all the different aspects of healthcare, but in particular, it's that education around how healthcare works, like the nuts and bolts of it.
Yeah.
I think when people understand like what actually happens when you call someone and call an office or try to reach an insurance company for something that they denied, why that happens.
Yeah.
So that in and of itself, I think, yes, they're all other episodes. So I think we can probably plan out like 10 more episodes based off of
we
each one
could
of those
do
things.
A series.
Yeah,
we can open up a series,
a health education series,
or you start your own podcast that could help you be able to do something.
I would love that, and I know who my first guest will be. It's Kate. Yeah, but
very flattered.
Yeah, I think really what it all boils down to is recognizing that all people and the populations that they are a part of have equal worth, that everybody matters.
I like the phrase, everybody means everybody.
Everybody means everybody. And what that requires is a real effort to address historical injustices and inequalities. And sometimes that means doing more for these populations than you would for the general population.
Yeah.
Because ultimately our society has created the problem of health inequity and health inequality. So it's our job as healthcare providers, as larger health executives and health organizations, payers, things like that, to address that. It is our duty as members of a society to take care of the people that are less fortunate than us.
Yeah.
And in this context, that are sicker than us.
Yeah. That's huge.
Yeah. Sorry, I get super philosophical about this stuff because, again, I always have the mindset of the ideal society that Star Trek strives for and has taught us. Yeah, it's, considered something for sci-fi nerds, which I very much am. But is it so bad to strive for something like that?
It's a great thing to be able to do so.
Yeah.
That's how we find improvements.
Exactly. Even if logically we'll never achieve that, because if we take this to more sayings,
human beings, we're faulty.
Yeah, perfection is the enemy of good.
Yeah, true.
But yeah, let's try and all be good.
Take care of your neighbors. Look out for your community. Look out for people around you.
Yeah, it boils down to just being a human.
Just be a good person.
Yeah.
Rule number 1: be a good person.
Rule number 1.
Then there's been lots of like words of wisdom and things like that dealing within the medical world and things in general in life. Do you have any words of wisdom just in general of life that you want to throw out there as well?
Well, certainly the be a good human is a good one for that, but I think I've used that now already. I want to say, and this maybe answers that question, is thanks. Thanks for the things that we do have. And I wanted to thank you for this opportunity.
So thank you for taking the time out of your day, because you drove an hour and a half to get here.
But it was a wonderful motorcycle ride. Motorcycles are dangerous, kids. Don't ride them. But
we're going to go do a ride after this. This is kind of ironic.
Yeah, exactly. But I think, being thankful for things we have, and thankful, so I'm thankful for this opportunity to be able to, as a subject I'm really passionate about and has been a massive part of my life for a long time.
And will continue to be.
And will continue to be.
And we're thankful for people like you that can do this.
Yeah, thank you. I appreciate that. But yeah, I think treat each other just like humans, and I think we'll all be okay. Yeah, it's a little hokey, but sometimes we need a little hokey in our lives.
We do. I agree.
Yeah.
Harendra, thank you for coming on, spending your morning/afternoon now with me. I look forward to our continual conversations here, and maybe they will lead to more episodes. We'll see kind of how that goes, because I'm looking to expanding out how the podcast works. And since we're coming up to 100, I've got to change it up a little bit here. So
you can have a panel on this next.
You know what? That's not a bad idea. Look at this.
That idea is for free. The next one's going to cost you.
Oh, okay. Send me a bill. Just put it on my tab. Put it on my tab. Well, with that, everyone, if you would like to be able to reach out to me, my email address is Cade, which is spelled CADE, at learningfromfriends.com. You can be able to find me on Facebook, Learning from Friends Podcast. I have a Patreon page if you'd like to be able to go on and donate through Patreon as well. Email me any questions that you would like to be able to ask Harendra, and what I'll do is I will get that message back to them, and then they will be able to give this back, the information. That's the way we're going to communicate through this one, because I don't want to bombard you with emails and all this stuff right now. I can be able to filter through it a lot easier for you.
Oh, that's great. Thank you. I appreciate that.
And with that, everyone, enjoy coming up on. It's been a pleasure to be able to almost get to 100 episodes with you. Go back and listen to a wide variety of topics there. I look forward to seeing what the years come. But as you all know, as the episode kind of comes to an end here, my name is Cade Curtis, your tour guide in this lovely adventure I like to call Learning from Friends. And most of all, don't forget to let your curiosity fly high.